You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Curran Mohan.
Hello and welcome to another episode of All the Pieces. I'm your host, Dr. Mohan, and today we have a very special guest. But before we meet our guest, I would like to talk to you about the podcast itself. It is available on all platforms, including Spotify and Apple Music. I know you all are clamoring to jump and listen to all these podcasts, so you have multiple platforms to do so. Today, we'll be discussing Women's History Month. It is an annual observance that is in the month of March, noted in countries such as ours in the United States, Australia, and United Kingdom. I think it's a kind of an underrepresented genre of celebrations, as it's only given a month. However, it is a notable month because it celebrates the contributions of women throughout history and their impact on our current society. And today's guest is my dear friend and colleague, Dr. Jane Schwabe. Welcome, Dr. Schwabe.
Thanks.
So I asked this question to all my guests, well, most guests. Do you listen to podcasts yourself?
Not very many, but I do listen to The New Heights, so
Okay.
New News. I'm a big fan.
Excellent. And All the Pieces, of course.
Of course.
Top two, right? So, Dr. Schwabe, first of all, thank you for being part of the podcast. Women's history is obviously something that we celebrate across the world and something we like to highlight across our institution as well. Can you give us a little bit of background of how long you've been here at Mosaic and how did you decide to go into cardiothoracic surgery?
Well, it's easier to tell you how long I've been than the other, but I joined February 1st of 2001, so just had my 23rd anniversary here.
Excellent.
Which is crazy because some days I still feel like the new kid on the block, but obviously now I'm the grandma. So
Not at all. I think it's all perspective, isn't it?
yeah. And as far as how I ended up in cardiothoracic surgery, that's kind of a long. I did not set out to go to medical school to be a heart surgeon. I don't even think I knew that it existed, but it wasn't even on my radar of something to do. So I totally believe this was a bit of a God-directed thing that I just got kind of drawn into it. I went to med school to be an OBGYN. That's what I thought I was going to want to do, was deliver babies. I thought that the surgery part was going to be too pressure-filled and that I wasn't going to want to do the gynecology part of it, that I was just going to want to deliver babies. So that was basically my ignorance of myself going into med school.
Right.
I had no mentors really that were physicians other than my primary care doctor. I'm old enough that there weren't like shadowing programs. There wasn't stuff to do like that. So
Right.
I really was very ignorant about what even the options were to do in medicine. So, the first 2 years was all book learning and, I was a good student. And then we went to our clinical years. And my first rotation was in general surgery. And at that time, they paired you with a surgeon to kind of get a more one-on-one experience. And I got paired with a surgeon at Creighton named Dr. Lewis Pinch, who was a pediatric surgeon. And he was a giant. He was a very tall, like 6'4".
Wow.
Wore size 9.5 gloves. So if you know anything about hands, I have a 6. So his hands were ginormous.
Kids must have loved him.
And then he's working on these teeny tiny babies who were probably the same size as his hand and doing all of this intricate work and let me do some stuff. And I found out I had kind of some dexterity. I'd played the piano all these years, and it flowed to things that I could do with my hands. And I never really even thought about surgery as a career or anything that I would be good at or want to do until that interaction. And so then I started kind of looking, there's obviously a lot of surgery that goes in OBGYN, and I thought, well, okay, that would be a good fit. But then I got pulled into the rest of the body and the critical care aspect of people, and I really liked taking care of sick people and trying to making them better. So intensive care medicine and management really was something I loved. I liked kind of figuring out how to make this person better, what drips could I use that could make them better, and that's sort of what drew me into more of the general surgery arm rather than OBGYN. So that's when I decided, okay, I'll go down and do general surgery. And then general surgery is a bit like medical school. You then rotate on all the different specialties that, at that time included vascular surgery, cardiothoracic surgery, obviously general surgery, trauma surgery, and cardiac surgery kind of started calling me because of the intensive care management. And then at Creighton, I had to do a year of research. And maybe this was laziness on my part, but there was a lab for cardiothoracic surgery that had an ongoing project. So I did not have to dream of something to do for a year. I could go into that lab and really just kind of pick up on the project that was ongoing. And that was the year that really nailed it for me, because I was able to do some of those surgeries in our labs, but also had time to read and kind of fill my brain with what I wanted to do. And that was the year that really kind of nailed down that CT was what I wanted to do.
That's amazing. I mean, it's kind of a circuitous way of
It definitely was. And then by then I had children and was married, and
wow.
It's like,
you were juggling it all at that time.
Hey, hun, what do you think about me doing another residency after I get done with general surgery? And
yeah,
we would have to. Omaha didn't have any training programs. We were going to have to move somewhere, and
right.
Will you move with me? And can I still keep my kids? Do I?
Is this a deal breaker?
Yeah, all of that.
Yeah.
And he was super supportive, and basically told me, I knew you were a thoracic surgeon before you knew it. He was an ER life flight nurse in administration, and he's like, I've seen all sorts of surgeons come through, and I knew before you knew that this is what you were going to do.
Wow. And what year is this?
This was
not trying to ask
no,
a bad question.
Between 1989 and I finished my general surgery in 1995,
right.
And then went to cardiothoracic surgery from 95 to 97.
Excellent. So before we go into the amazing support structure you have at home, so describe to me what the landscape was for women in medicine back in the 90s, especially ones pursuing a relatively competitive, maybe not so relatively competitive subspecialty of cardiothoracic surgery.
Well, there weren't very many people who looked like me.
Right.
Except in my year of residency, there were 2 women in our. We graduated 3 chiefs every year at Creighton, and there was another woman, and her name was Jane. So we had the 2
right.
Janes. But when I went to interview with our chairman of surgery for my letter of recommendation to get a surgery residency, the first thing he asked me is, why do I want to be a surgeon? Why don't I want to be a pediatrician? That's a lot better life for somebody who wants to maybe have children. At that time, I wasn't even dating my husband. I had no children. I had no love life.
Right.
And that was
medicine was your love.
Yeah, and that was the first question he asked me, and I was like, this is silly. So, but he goes, but if you want to do surgery, I'll write you a good letter because you've been a great student and you did well in your programs. But so that was the first hurdle, was to have to answer those sort of questions. When I interviewed for medical school at this would have been in 1983, because I was trying to go to med school right after graduation from college, and the question was, why do you want to be a doctor and not a nurse?
Wow.
And I was like, well, do you ask that of your male candidates? And they didn't like that very much, and I didn't get into med school the first time I tried. I had to reapply and got in the second time. But yeah, so the hurdles were there in a very somewhat covert, but sometimes not so covert, right in your face, like,
right.
Why do you want to be part of the boys club?
Right.
Well, because I think I can do the job, and I think it's irrelevant. So.
Right, and that takes a certain level of chutzpah, if I'm getting my Yiddish right, to answer those questions consistently and not lose your nerve,
Yeah.
Do you think those biases still exist today in medicine?
Yes, I think they're everywhere, whether it is intentional,
or covert.
And sometimes it's not malicious. It's somebody
nobody will say it's malicious.
Somebody will see me in the hallway and dress like this and assume I'm a nurse, even after being here forever.
Right.
Or early on, was I the dietitian because I talked to you about your heart healthy diet? Well, yes, I do talk to you about your healthy diet, but I also did your surgery or
Right.
did your dad's surgery.
Right.
So,
And I think that's kind of the whole point of it, isn't it? As we were talking earlier before this podcast was, to add that qualifier of, women's surgeon or anything along those lines. Is that really necessary in 2024? But I think you answered, and I don't think I got the complete answer, but you said that it is good to talk about an underrepresented community, even though on the outside it sounds like that qualifier may or may not be the most PC way of saying it, I guess.
I think, we'd all like to think it's irrelevant. It shouldn't matter whether your surgeon is a male or a female.
Right. Or if your nurse is a male or a female.
Yes, or if you're Black or Hispanic or whatever your sexual orientation is,
Right.
It should be irrelevant. But I think what's important is for other people, little girls out there in the community who might look to me or someone else who represents them and say, I could do that.
Right.
And where it might not have been that they, sort of like me, they might not have thought that it even was a possibility.
Right.
And then you see somebody doing something that represents you or your community or your aunt or your dad or whatever, and it's like, wait, maybe I could do that.
Right. I think that's a very important point, which is role models, right? Just to deviate a little bit, my mom always wanted to be a pilot ever since she was a girl. But growing up in 1970s, 60s India, there were no female pilots. And that sort of was kind of like a wish and, that sort of thing. But she did mention to me that if she had seen one, even on TV, that would have completely changed her perspective. So can you tell me which role models you had during your medical training?
During my medical training, Dr. Pinch was probably my biggest
Advocate?
I wanted to be like him for a while. I wanted to be a pediatric surgeon until I found out that the training was a little more arduous than I think my husband would have gone for back then. There was one female surgeon, Dr. Zielinski, who was a nun who had
very cool.
It was very cool. We called her Dr. Z, and she was a general surgeon who did kidney transplants. So we learned a lot of vascular surgery and stuff from her. So she was kind of a role model as far as a woman in surgery, because she was the only woman in surgery that I had at all through my surgery training until the very last year we got a female surgeon at the VA.
Right.
And then, most of my role models in surgery have been men,
Right.
because that's who I've worked with.
Right.
Some who were role models because I wanted to emulate them and learn some of their techniques, and some were role models because they were ones that I didn't really want to pick up on,
Right.
either their techniques or the way that they interacted. So I've had both positive and negative role models, and have tried to kind of meld myself from all of that.
Amalgamate the best and the worst.
Yeah.
So, obviously, my training, I trained in 2008, 12, I can't even tell. I think in 4-year chunks.
Yeah.
Culture has definitely changed in healthcare. Obviously it's changed from the late 90s to early 2000s to now. How do you think the culture is today versus back when you were starting off?
I think there is a lot more representation of women in all specialties, of people of color in all specialties, people from other countries. I was very surprised at kind of the mixed medical staff we have here, because we are an underserved area. We have quite a few people here who may be on a visa or whatnot.
Right.
But it's just been very welcoming. The one thing that we probably don't think of right now, but when I went to medical school, there was a big difference between DOs and MDs.
Right.
We think of them as equivalent. They are equivalent. In fact, the smartest doctors I know are DOs rather than MDs. But when I
Dr. Turner would like to hear that.
Yeah, when I went to medical school, it wasn't that way. And on the West Coast, it was very discriminated against to be a DO. And then come to the Midwest and the home of osteopathy
Right.
is right, around here. And so that was one of the first things that opened my eyes to, what a diverse community we work, because we're kind of 50-50 here.
Yeah, and I think that's a whole different sort of stigma that a lot of DOs had to overcome. Thankfully, I have to say our profession is a little bit welcoming and self-adjusting. So I believe, we're talking about your journey in cardiothoracic surgery and what led you to that decision making and sort of the scenic route through all the subspecialties. I believe you are the recipient of a very prestigious award. I believe it's called the Extraordinary Women in Cardiothoracic Surgery Award from the Society of Thoracic Surgeons, which was in January of this year.
It was.
Excellent. Can you tell us a little bit about that and what led up to that moment?
Well, they started the award last year, and it was championed by, surprisingly, a group of male surgeons who felt like, women in thoracic surgery are very underrepresented. When I finished...
That's a whole loaded separate,
Yeah, when I finished when I got board certified, my boards were 6,071, and I was the 92nd woman to be board certified. So if you do the math of all of the people that have been board certified, less than, it was 1.4% of us back in when I certified that were women. It's now up to about 10%. We've gotten better, but we are still not where we should be.
Tremendous from that time to now, but still grossly.
Yes, considering our population is basically 50-50.
Right.
You would think that if we mirror the population, that it should be close to that.
Right.
And that's our goal. But,
that kind of goes to the question, is it easier for women to go into cardiothoracic surgery now than it was in the past? Or do you think it's the same level of toughness? Or do you think there are some other challenges unbeknownst to us that you didn't know back then?
I think it's still difficult for men or women to go into cardiothoracic surgery. The training programs in general have gotten a bit kinder and gentler than they were. The 80-hour work week has made it easier, not necessarily easier, but recognition that lifestyle and that work-life balance and having children and all of those things should be attainable for men or women, which were things you didn't even talk about back in the day, and you didn't really even think to talk about because it was just a foregone conclusion that residency was going to be your life, and if you had an extra 5 minutes that you could go on a date, then that was great, but just don't talk about it.
Don't be selfish.
Yeah.
Don't be boastful about your life.
Yeah, so for women to have children during surgery training or cardiothoracic training.
Which you did.
Which I did, which was not a common thing. There's just a lot of things behind the scenes that went into that. Having a supportive partner or family or tribe or whatever it was that you needed to make that work. But there, things have changed a lot on that.
Yeah, so you mentioned you kind of were juggling a very intense residency, post-residency training, and at the same time now being a new mom. And how many kids do you have? Remind me.
I have 4 that I birthed.
Okay.
1 set of twins, and then I have 2 stepdaughters.
Okay. So this was all during training? Mm-hmm. How did you juggle it all? And I know that sounds almost like a laughable question, maybe a little, insulting, because that's sort of, you did it all, obviously, but how did you do it?
Well, I mean, I didn't do it all. I mean, I birthed them. I had them, but I had a incredible amount of help. My husband, my oldest stepdaughter was about 12 when I had my first child, and so she was a great babysitter. She helped a lot, especially if I wasn't on call. We had friends and parents that were able to help us, but I mean, I give it to my husband for helping make this work. And the rest is just, I look back on it and I'm like, I don't know how we did it, because now when we have the grandkids for the weekend, we're like completely worn out and have, it's like, how did we do that and manage to get the laundry done or go to the grocery store? But you just did. You just did. There was no, you just did it because that's what you had to do.
The best way through the mountain is through the mountain.
Exactly.
And that speaks volumes to the network it takes to any successful man or woman to be, to pursue a craft, a trade craft, a excellence that is much needed, and I've heard this, and it might sound a little bit glib, which is the best investment a doctor can make is a life partner.
Yeah.
You know? So tell me more about the challenges you think current women physicians or women who are thinking about going into medicine, what are they facing now differently from when you were training, and what we can do, not just as physicians, but as a community to help support them?
Well, I think women are facing the same thing that we face, that, most of us are training in the midst of our childbearing years, as are men when, you're looking for families and whatnot. And so making it a possibility for women to have children and to have an adequate amount of time to recover from childbirth, and men to have time to bond with their children, access at the hospital for things like a safe place to breast pump, which
Right.
that didn't exist. I was
Right.
able to nurse my children, but I went into some pretty sketchy places to use breast pumps because that's what you had to do.
That level of gender equality was not recognized readily back then. I mean, it is now, thankfully, but even those are for highly cognizant sort of organizations. I know we touched on the dual roles you played. I just want to quote Dr. Katie Diaz, who is the president of Mosaic Albany Medical Center. And I have a quote from her. She recently wrote an article discussing, for one thing, the contrast between her grandmother and her in terms of viable vocations. Her grandmother having chosen to be a stay-at-home mom, and Dr. Diaz pursuing medicine. Here's a little of what she said. While I've been given every opportunity to achieve any academic goal I've set and been treated as a peer, both in status and in title, with my male counterparts, I don't know that society was prepared to respond to the present-day magnitude of gender equality. Some women still feel that they must choose between being a wife and a mother and having a career outside the home. I know you have sort of touched upon that a little bit. What strategies or what thoughts that you can impart to the up-and-coming women in this profession, cardiothoracic surgery or otherwise, whether it be OB-GYN or anything like that, from your sort of vantage point of 23 years of experience and accolades and that sort of thing?
Well, I think it's that you don't have to choose between your career and having a family, but you do have to go into it with open eyes. The thought that you can, or that I did everything. I did not do everything. You can't do everything. You have to outsource some stuff. You have to understand that you're not going to be the perfect mother, the perfect spouse, the perfect doctor, ever. None of us are. And you're going to do the best you can. And then you need to build your village. You need to have some support, whether it's your spouse, family, friends, church, whatever that looks like, to help. You may not cook homegrown organic meals every night. You might have to use frozen chicken McNuggets or whatever.
Guilty as
and that's
charged.
okay. Your kids will probably still grow up and have all their arms and legs and teeth. So you
Right.
just have to know that there's no way anybody can do everything and do it perfectly. You just have to do the best you can do. But you don't have to choose one or the other, but you do have to choose differently. I came to St. Joseph because this was a community I was going to be able to be present in my children's life. I didn't stay in academics because, well, I didn't have any mysteries of the universe in my side that I needed to solve. But I didn't want to give up the time with my kids in order to be doing research projects. I didn't want to live in a big city where I would have to go to 5 different hospitals. I wanted to live someplace where I could work at one place. And here I live 2 minutes from home, and I could go to my kids' things, but I couldn't do that in a different city.
Right.
So, I chose to practice this type of medicine, which was the perfect fit for me, not necessarily the perfect fit for somebody else. And I would not have done nearly as well, or I don't think my family would have done as well if we were in a big urban setting. Life would have looked way different.
Right. And what an impact you've had on the community. I know we talked about your immense work in the cardiothoracic surgery world, but you've also done a lot of stuff in the community.
Mm-hmm.
Can you briefly touch on that?
Well, I love the community. I love St. Joseph, and I love a lot of this started when my mom got sick and realized that she had heart issues, and she didn't know that she had any of the risk factors. And I thought, if my mom doesn't know, most women probably don't know. So kind of started working on education, and then out of that grew the 4th grade challenge, which I just loved, because I think all of us in medicine would love to see the next generation grow up healthier and not have the same hurdles that we have. If I could put future heart surgeons out of business because we raise a healthy population, that would be great. We worked on a smoking campaign to try to get smoking out of public places, and that was successful. Took a lot of work and had a lot of help. That was not something that I did on my own. I was sort of the face point of it a bit,
right.
But a lot of people who helped us get that done, and great support here that Mosaic gave to help us do that. So the community work that I've done is some of probably second to my family and my patients. The community work is, my 3rd favorite baby.
That's your 5th baby, right?
Yeah.
Well, thank you for all the great work you've done in the community, Dr. Schwabe, and I can tell you we are tremendously better for it. So, and as we wrap up, I would like to, first of all, thank you, and obviously thank all women in the organization for the tremendous work they do in taking care of our community and our patients. And I would like to thank my wife, who is also a practicing physician and a mother of 3 and has been called a nurse more often than she's been called a doctor. And give her a little shout out, because it is not easy. I can tell you from personal hand experience. And for all the little girls out there, I know it sounds weird from coming from a man, but it can be done and it should be done. And this representation is just a little bit short on just 1 month a year. It should be lifelong and every month of the year. So with those parting words, I am your host and All the Pieces podcast, Dr. Karan Mohan. Take care. Brush your hair.
Thanks for joining us for this episode of All the Pieces. Missed a podcast or interested in more information about any of our topics? Visit Connected to access the resources you need to be informed. Interested in having us cover a specific topic or giving us feedback? Send us an email at myepic@mymlc.com. We'd love to hear from you.